What's up, everyone? So, if you hear some background noise, some mowing the lawn, or some doing some laundry as well, I apologize, but I just gotta. It's the only place that I can do it. So, anyway, in today's important video, and I stress the importance of the word important, is because a lot of this information you're not gonna get from your doctor because they're just kind of following what the CDC and the WHO tells you. But today's video, I wanted to talk about unfiltered and tell you about the highly inaccurate swab test for the COVID-19 virus, the coronavirus, aka the, if you've heard of it, the PCR test. Now, I've spoken briefly about this in other videos, but I wanted to strictly talk about the inaccuracy of this test in this video, and the reason why, and what spawned me to do this, is that as of right now, I got an email from like sometime last week in my work, because I work in a hospital. They said that it is required and mandatory for us to take the swab test, the PCR test. Before it was optional, and they just keep kind of pushing the boundaries. And as of right now, according to my union, I'm not required to take it. I'm hearing conflicting things, so I'll keep you updated on that. Nonetheless, this is what propelled me to want to do this video. So first and foremost, if you don't know, the majority of testing, there's two types of tests. There's antibody test and the swab test. Let's talk about the swab test for this video, just because they're trying to make me take the swab test. Now, the swab test is the PCR test. It stands for the polymerase chain reaction test. And I'll try to break this down very simply, but you get a little swab, and they shove it up your nostril, and they push it up pretty far up. You take it out. They take your DNA sample, and they send it to the lab. Once it gets to the lab, they basically they heat your DNA, and I call it a heat cycle. I don't know if that's the official term, but it's basically a cycle in which they heat it up, and then they do another cycle, do another cycle, do another cycle. Eventually, when it hits a certain amount of cycles, usually the PCR is supposed to tell you if you have the coronavirus, the COVID-19 virus. The big fundamental problem, and Michael Mina, an epidemiologist from Harvard, and a bunch of other doctors that are, not being talked about, because obviously the information being put out there is all pretty much just censored. They can back up my assertions that the cycle threshold, there's a numeric value that they put on it, and it's too high. They put it at about 35, sometimes 40. And the crazy thing is that you would think that during a quote pandemic that every lab would have a standard cycle threshold, a numeric value, but it's just not the case. Some labs set the cycle threshold at 40, some at 35, some probably higher, some lower. And the problem is that when you set the cycle threshold too high, such as 35 or 40, what occurs is that you increase the chances of getting false positives. How is that? How is that so? Well, it's kind of like if you get a piece of gum and you throw it up against the wall, it may not stick the first time. It may not stick the second time, but eventually it's gonna stick. And this is what the big problem with the PCR test is. It's a qualitative test. It's qualitative. It's not quantitative. It doesn't tell you how much of a virus, if there even is one. It only tells you that there's some. It's like a yes or no, and that's just not valuable. So Michael Mina, the epidemiologist from Harvard that I spoke about, he did a 3-state comprehensive test in which he took samples from 3 different states, one of them being New York, which is one of the hotbeds of the supposed COVID. It was like New York, Nevada, and I forgot the other state, maybe Arizona. Took a bunch of samples of these people that supposedly tested positive under the swab test, the PCR test. And what did he find out? He found out that up to 90% or higher of these samples had cycle thresholds so high, 35 or 40, that they were being mistaken for false positives. Because when you set it too high, it gets to the point where the virus is so minuscule, it's so small, it's so irrelevant, to the point where it could be a germ, it could be something totally irrelevant, it could be from a common cold, it could be that you had something in the past. Nonetheless, the higher the threshold you put this test, the increased chances of it being mistaken for anything. So you could have had a common cold coronavirus. You could have had this coronavirus. And this is what is jumping up the number of, driving up the number of cases. And what they don't tell you is now a lot of hospitals across the country, they're hurting for funding because you got to remember at the beginning of this pandemic, they held off elective surgeries. So they're getting a lot of federal funding for COVID cases. Now, I'm not saying every hospital is doing this for the sole intention of financial backing, but whenever there's money involved, things always get a little bit murky. The other thing is that so the other reason why I'm hesitant about taking the swab test is that there's about based on what I researched, a 5 to 8% chance of getting nosebleeds, and I actually am prone to getting nosebleeds due to my allergies. And back in my early 20s, I would get constant nosebleeds, and I had to go to the health center on campus when as an undergraduate in college. So even when I get a lot of allergies and I go like this, I can get nosebleeds out of nowhere, and I don't want them shoving up the swab really hard up my nose. Also, the people that test and put the swab up the nose, up your nose, a lot of them they just got a crash course. They don't do it very often for obvious reasons. But now that it's a gold standard, everybody and their mama is making you get the swab test. And when they don't do it properly, like this one lady, they shoved it up so far up her nasal cavity that it hit her brain lining, and then actually brain fluid leaked out, and luckily she didn't die, but she had some side effects. Other people have had, like I said, nosebleeds, a lot of headache, ear pain, constant runny nose, and other things such as that. So some people might say, well, that's just a small side effect, big deal. I'm willing to take that risk because I don't want to get the coronavirus. But the thing is, I don't go by that. I don't go by it because it's no more deadly than the flu, and the data backs that up. In addition, like I said, due to other reasons, the test is not, I mean, 90% plus. It's false positive. It's fake stuff. It's completely fake. So I'm willing to take that risk. I'm not going to shove something up my nose that I know is not even accurate. I mean, they haven't even isolated the virus, and I'll save that for another video if you want to go down that rabbit hole. They haven't even isolated it, under an electron microscope. They have not isolated it. They can't tell you what exactly it looks like under a microscope. I mean, I looked all around and I found like one article, and it says we found what it looks like under one patient. One patient? If it's the virus, you should be able to find it on multiple patients. It should be clear as day, but they have not proven that. So anyway, I'll keep you up to date. As of right now, I am not going to take the swab test because, like I said, I am not going to get a bloody nose. I'm not going to freaking hit my brain fluid for something that I know is not accurate in the first place. You can call me selfish, call me whatever you want, but I'm still having to wear a mask. They keep pushing. First it's a mask, then it's a goggles, then it's a visor, then it's a gown, then it's pretty soon I'm going to be in a hazmat suit. I get no relief from this amount of freaking, mask wearing, and it's just constant, and that's the other thing, the wearing the mask things is this actually increases the chances of getting false positive because you're breathing in, like if you're sick to begin with, like a common cold, you're breathing in your own CO2. Usually without a mask, if you have a cold, you expel your oxygen, your CO2, and it helps get dissipated in the oxygen-rich air. But what happens is when you're covered like this and you keep breathing in your own germs, it just goes in and out, in and out. You're taking in less oxygen, and then conveniently, when that happens, you actually increase your chances of getting a false positive. You get driving up the cases, more federal funding, and it just keeps going and going and going. So you're not going to hear this from them. I mean, you can go and ask a doctor, and they're just gonna, they're medically trained, just like from the establishment. So they're gonna tell you the cookie cutter idea that you should get tested. But like I said, if you're not in the high risk group, I would not shove that thing up your nose. I just wouldn't. That's just my take. I'm not a fearmonger. I'm just giving you my raw opinion on this. But do what you want to do. But you're not going to get this type of information by just getting it from the mainstream media, because there are a bunch of dumbasses who don't know what the heck they're talking about. The average person doesn't even know what a swab test is, and I'm not trying to make myself sound like I'm superior or anything. But I do this research independently. I have no stake in this game. I'm just putting out this video for you guys and gals to decide what you want to do with your body, with my information. So that's my time. Thanks for watching. The only thing I would suggest, if you made it this far, is anything that you take from my videos regarding this whole, pandemic. Um, if you believe in it and the research backs it up, and do your independent research, if you do believe in it and you do happen to talk to someone about this, please give them some of this information so they can decide. And knowledge is power. So that's my time. Thanks for watching. I'll talk to you later. Bye.